and other cells in the bone. You can find fibrosarcoma within the bone, liposarcoma within the bone. Okay? They are classified according to the bone matrix diagram. عشان بعدين لو لقينا liposarcoma from within the bone ما تستغربوا. Okay? The most common soft tissue sarcomas are malignant fibrous histiocytoma, what is known now as pleomorphic sarcoma. نحن عندنا benign fibrous histiocytoma. ودي واحدة من النماذج also you should say is it malignant fibrous histiocytoma. لو قلت كده this means soft tissue. If it is found in the bone, you should say malignant fibrous histiocytoma of the bone. Okay? Of the bone. Pleomorphic sarcoma, liposarcoma, leiomyosarcoma, and synovial sarcoma. Why we are worried about the behavior of sarcoma? Why? It gives the basis of staging. Where if now, why we are seeing for staging? For prognosis, right? And treatment of strategy. Then histologically, sarcomas are graded as low, intermediate, and high grade. This is the classical. According to your level, this is the classical. Low, intermediate, and high grade. Nowadays, they are only low or high grade, to be honest. And the striking example is osteolysis sarcoma. In the classical way, they're classified as intermediate, but nowadays are high grade, okay? Presentation, as Mr. Hassan said, pain, swelling, pathological fracture, neurological symptoms, etc., etc. Why pain? Compression of surrounding tissues, central hemorrhage, necrosis, and pathological fracture. Okay? بس عندي تعليق بسيط. شفتوا كيس بتاع osteomyelitis مش كده؟ Yes. Very painful. That's why pain received وناس in the same increased intracompartmental pressure. Generally, sarcomas form a solid mass that grows centrifugally. They grow centrifugal, from the center and out, right? Because carcinomas grows in the centripetal manner. Okay? This is centrifugal, and لو جرحت حاجة في المويه هنزاح الدوائر. Okay? دي فيديو المفروض تشتغل. So sarcomas are enclosed by a pseudocapsule. الحتة دي مهمة يا شباب. بعدين لما نتكلم عن التريتمنت الحتة دي مهمة. Sarcomas are enclosed by a pseudocapsule which consists of compressed tumor cells. بنسميها شنو؟ satellite lesion. هتلقوها في الكتب. Satellite lesion. And fibrovascular zone of reactive tissue with variable inflammatory cells. Actually, it consists of fibrovascular zone of reactive tissue and impeded within a malignant cells. Can we look at the بداية to give you attraction to it? This will be compressed tumor cells. This satellite lesion. This will be reflected later on the tumor management. Okay? This is what I just said about. If this is the tumor. واضح مش كده؟ Yes. This is the pseudocapsule. This is the pseudocapsule. And this will give time that the body will try to react to the tumor by forming this pseudocapsule. It's not true capsule. Malignant. It's not a true capsule, okay? If it breaks this pseudocapsule, then nothing will will stand in front of it. The thickness of the reactive zone varies with the histogenic, I mean the grade of the tumor. Grading and staging the hand movement. Please, grading is part of staging. Grading is part of staging. Grade depends totally on histology under microscope. Please, okay. So the thickness of the reactive zone varies with the histogenic type and grade of the tumor. Okay. These are the examples. High-grade sarcomas break through the pseudocapsule to form a metastasis, what we call skip lesion. This is an example of skip lesion, which is a discontinuous lesion from the main or the primary tumor, but within the same compartment. Within the same compartment. Okay? This is a femur, right? This is a discontinuous lesion from the primary tumor. Here, we call it skip lesion. If I have a lesion down there in the tibia, proximal tibia, I call this this is a because tibia is another compartment. Okay? Okay? So, sarcomas respect anatomical borders. This is known up to a limit. Okay? In later stage, the walls of that compartment are violated. It is the center. As I said, it will start in the center. That's why the pain precedes the mass. This is necrosis. Then it will come outside. Yeah. Goes outside. Breaks the border, the anatomic border. Most bone sarcomas are bicompartmental at time of presentation. And to be honest, most of osteosarcoma are presented with almost 10 to 15% presented with distal metastasis. One metastasis at time of presentation. Very dangerous osteosarcoma. Okay? But generally speaking, the most sarcomas, not osteosarcoma alone, sarcomas are bicompartmental at time of presentation. Okay? What about joint involvement? It comes through the direct extension of the tumor to the joint is a bit rare, unless in the late stage. Unless in the later stage, okay? The risk factors for it is fracture. Unfortunately, most of it is iatrogenic. Iatrogenic. Very rare tumor extend inside the joint. Whereas, if this happens, it could be due to pathological fracture or iatrogenic. The most common cause is iatrogenic. الناس اللي بيشتغلوا معانا بيشوفوا الحاجات دي كتير. يمشي ويشتغلوا لهم على اساس amyloiditis and abscess, we go to the joint. And will be another option than amputation. Okay. Very rare spread can go through the patellar ligament, tendon, pericapsule, okay, or via intra-articular vessels within the ligament, ACL, ACL, okay. These are examples. We're going through the. Now we talk about the metastasis. Metastasis of sarcoma. Unlike carcinomas, they are metastasized through blood vessels, hematogenous. Hematogenous spread. Carcinomas, the main way of metastasis is lymph nodes, lymphatic vessels. Okay. Hematogenous spread of the extremity sarcoma is manifested by pulmonary metastasis. That's why we said CT lung is mandatory. CT lung. Abdomen and pelvic soft tissue sarcomas metastasize to the liver and the lung. The common site of metastasis for all sarcomas is the lung. In addition to others, according to the time of presentation. Okay? Bone sarcomas can metastasize to bone. Bone is a common site of metastasis also. Okay? High-grade primary sarcomas, unlike soft tissue sarcoma, have distant micrometastasis at their presentation. This is what I have said. Okay? Very early. Lymphatic spread is the main route of metastasis for carcinosis. But still there is exceptions. Some soft tissue sarcomas are known to have lymphatic metastasis. That's why they said 13% of soft tissue sarcoma are lymphatic spread, and even some bone sarcomas in late stages have lymphatic spread. Around 7%. This is the last slide. Yes?